Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on accelerated recovery performance. And bringing us this information is Dennis Thompson, an exercise physiologist with ARP Wave. Welcome, Dennis.
Thank you.
I am so delighted that you could join us because this is such an up and coming and it's exploding. And it's the ARP Wave.
Correct.
So that's a good little smaller way of putting it for you.
Right.
But I don't think my viewers have ever met you because this is the first time on Knowledge for Wellness, which is great, and I'm so delighted to have you here. But I'd really like you to back up and tell everyone about you are the inventor of this device, and it is FDA approved.
Right.
And just take a minute, boast about yourself, boast about the invention and how this came about.
Well, it all came about because of a disenchantment with how we address soft tissue injury and how we address athletic injury. Traditionally, we address it with a technology called rest, ice, compression, elevation, better known as RICE.
Okay.
It's about a 200-year-old therapy. So if you sprained your ankle 200 years ago, they would use rest, ice, compression, and elevation.
Sure.
You sprain your ankle today, 200 years later, they use rest, ice, compression, and elevation. The results are going to be the same.
Right.
Typically, an ankle sprain will be anywhere from 3 to 4 weeks. With the ARP, that 3 to 4 week injury is 2 days.
Wow.
So it dramatically shortens the period of time that you have to suffer with pain. And that's why it was invented, is because of the disenchantment with how we previously have already dealt with injury.
Right. And I understand that the device actually has electrical current along with the actual wave that's part of the body. So it is in harmony with the body.
Totally.
Right. But I know a lot of my viewers don't know that much about, so could you explain exactly the ARP, the actual system of the device?
Sure.
Yeah.
Typically, if you've ever been to a doctor and they've used what's called electrical stimulation on you, they traditionally use that with muscle injuries.
I'm familiar with the TENS unit with the chiropractor. Okay.
Right. Makes absolutely no sense.
Okay.
0 sense. Here's why. When you're hurt, your body is getting a signal from your nervous system to protect you. So let's say that when you're not hurt, your muscles are out here. They're relaxed.
Right.
When you're hurt, the muscle shrinks. It's called concentric contraction.
Okay.
And it's designed to protect you and protect the joint from moving. That's a basic function of your body. Okay. When you put electrical current into the body, other than this, it takes that muscle and shortens it even more.
Okay, we don't want that.
We do not want that.
No.
It's like having a leg cramp and keeping it forever. You definitely don't want that. Without movement, you have no healing going on. So unfortunately, all of the devices out there, transcutaneous nerve stimulation, which is TENS, then you have galvanic, you have interferential, you have microcurrent. All of these different current types of devices all shorten the muscle.
Okay.
This is the only device in the entire world that allows the muscle to elongate, and we'll see that here shortly.
Okay, that sounds really great. Well, so I'm familiar with a lot of, when someone, has to have a hip replacement or something like that, and then they go and they do physical therapy. Do you do physical therapy?
No.
Okay.
Physical therapy is a tremendous art, takes a lot of schooling to get, and they're very, very skilled at what they do.
Right.
Unfortunately, what they work on are symptoms.
Okay.
So wherever, and what I'd like your audience to know is wherever you have pain is where the problem ended, not where it's coming from. Where physical medicine works on where the problem ended, we work on where the problem's coming from. And the only way to solve a problem is get to the root of the origin so it eliminates the symptoms of the problem.
Okay. And so by doing that, you actually assess people when they come in, because they'll tell you, oh, I have a little kink in my shoulder and it's very painful. and then you actually follow up with and do the process of.
Right. We actually do a technique that we call body mapping.
Okay.
Where, let's say you say your knee hurts.
Okay.
Well, we're going to put an electrode right on your knee, and we're going to take another one and put it someplace off on your body, and we're going to turn the power up on this device. And what the device is looking for is the origin. And the origin is where the muscles are walled off by scar tissue, and the inflammation is inside that wall. So think of when a muscle is hurt, inflammation comes immediately, and then that inflammation is walled off by this wall, and we call that scar tissue.
Okay.
What this device does is it goes in and it finds out where that inflammation is walled off, causing the signal to come down here to bother you. So we're going to scan your body, and when we find that spot, we call it a hot spot, we know exactly where to treat you.
Wow.
And it's instantaneous. I've never treated a shoulder problem in a shoulder. I've never treated an ankle problem in an ankle. I've never treated a hip problem in a hip. And I've never treated a knee problem in a knee, because those are not the origin of the problem.
And so this device actually finds
exactly where to. We don't treat anyone until this tells us where to treat them.
Wow.
And if it normally would take you, let's say you came out of surgery, and the doctor says it's going to be 9 months for you to recover.
All right.
Okay. We go in, find out exactly what caused the need for the surgery. 6 weeks later, you're fine.
Wow. And so this is FDA approved that we mentioned
earlier. It is FDA
earlier.
approved, been around since 1989. We made a business out of it after testing and testing and testing the protocols. And the protocols are how you use the device, not the device. The device is nothing more than a tool. It's a tool to prevent injury. It's a tool to speed up the recovery of all types of soft tissue injuries. And it's a tool to build the strength back up in muscles.
Okay. So your philosophy of your actual business is to try and make everyone well?
Well, I think the overall mission of our company is to replace rest, ice, compression, and elevation, and replace it with ARP.
Okay.
And ARP stands for Accelerated Recovery Performance. So what we do is we accelerate the recovery of any issue whatsoever to allow you to have a quality of life that you would normally never have.
Right. And your recovery time, along with preventative
about 80% less than normal.
Wow. And so then you're talking about your sick days, that people have to take off, and the cost of that.
Absolutely.
And you would think that this would be in every doctor's office and everywhere around.
Well, you would think so.
That. Yes.
And unfortunately, you have to look at the economics of medicine. So many people make their living on you being treated by them for prolonged periods of time. So we're not going to be all that successful going to a practitioner and say, hey, wait a minute, I got a great idea. Why don't we cut 75% of your income away and let's help this guy? It ain't going to happen.
Right.
So what we've done is we've educated doctors and therapists on how our system works, and it's becoming world known.
Yes.
So that's a good thing.
Yes, and especially for the patients.
Oh.
What a quality of life.
Unfortunately, it's never about the patient. With us, it's only about the patient.
Yeah.
Because there's no economic agenda here. It's all about doing one thing: speeding up your ability to have a quality of life that you deserve.